Since it first appeared in Wuhan, a province in the country of China at the end of December 2019, the coronavirus has infected almost all countries and small regions around the world. Until finally the World Health Organization established this recalcitrant virus as a global pandemic. For some people this disease is not terrible, this is evidenced by the increasing number of healing. However, many also lost their lives because of this virus. Until June 2020, corona sufferers worldwide have reached 6.1 million confirmed. A cure report of 2.6 million and a mortality rate reaching 372,000. If you are exposed to this virus, what will happen to your body? What should you do? And how to treat it? First, you need to know the incubation period for the coronavirus. The incubation period is where the virus starts to infect the body. Initially, this virus will infect cells lining your throat, airways, and then into your lungs to turn it into the coronavirus market, which will give birth to new types of viruses and continue to infect more cells in your body. At this stage, the symptoms of contracting the virus are very mild. You will not feel pain. Even some people have never experienced symptoms. The time of infection and the first symptoms that appear are highly variable. Organizations state that the incubation period for COVID-19 is between 1 to 14 days, but the most common is around 4 to 6 days. During this period, you must do the following to overcome this. Choosing foods with good nutrition, diligently washing hands, and live physical distancing. Don't go out at home. Bask in the morning sun for 30 minutes. Avoid using personal items with the family, such as plates, spoons, forks, glasses and other equipment. If a person infected with the coronavirus is forced to share rooms and personal equipment with healthy family members, make sure the room and equipment are clean first using disinfectant liquid before being used by other family members. Unexpected mild symptoms. This is what endangers others according to health sources that have been collected. The main symptoms are fever and cough that are ignored. Body ache, sore throat, headache. It depends on your immunity. When you have a fever, a condition that occurs when your immune system declines and responds to infection. This is what most people with COVID-19 experience. Coughing due to coronavirus, in the beginning is a dry cough, and this may be caused by cell irritation when cells are infected by a virus. Some people will eventually begin to cough up phlegm, thick mucus that contains damaged lung cells that are killed by the virus. These symptoms will generally last around 7 days. Most people recover at this time because a good immune system has killed the coronavirus. In this situation, this is the right course of action that you must take. Stay calm and don't need to panic excessively. Isolate at home for 14 days or more. If you have a fever, take the fever-lowering medication that you usually take and consult a doctor if the fever does not improve quickly. Drink more water, eat foods that have high nutrition, exercise regularly, get enough rest at home so that the body remains strong and immune to viruses. Self-isolation at home will end if fever is gone and not taking fever-lowering drugs for 3 days in a row. Coronavirus symptoms such as coughing and shortness of breath have improved and even disappeared more than 7 days since the symptoms first appeared. Severe symptoms that can cause sudden death. These symptoms will be marked when you have super high fever until your body temperature reaches 38 degrees Celsius or 100 degrees Fahrenheit. Your body will shiver and you will experience convulsions. Difficulty breathing like someone who is about to die. Have a history of diseases such as diabetes, cancer, acute respiratory infections, asthma, heart disease, and others. You cannot do any activity. In this situation, you will experience pneumonia and some people need a ventilator to help them breathe. Then, what do you have to do with this situation? Report to emergency health contacts according to your area. Go to the COVID-19 treatment hospital. Always wear a mask. Perform ethics sneezing and coughing using tissue or inner elbows so that the spark from the mouth does not stick to an object or another person. After that, immediately throw the tissue into a closed trash can and wash your hands under running water with soap. Eat healthy and highly nutritious foods and drink lots of water. After that, you will undergo a period of isolation in the hospital for the next few days until the coronavirus is completely gone in your body. When you are tested positive for a virus by medical staff, the first thing to do is not to panic and believe that you will recover. A psychologist said,
"Panic, anxiety, and stress can cause the immune system to decline, making it vulnerable to diseases, including coronavirus infection."
The most important thing is that you have to think positively and calmly so that mental health is guaranteed and your immune system isn't weakened. So, change yourself for the better starting now.